I want to know what the actual ketamine or psychedelic assisted experience is, like the Odyssey method. I want to know what exactly it is. Like, what do I come in to the EntheoMed clinic in Kelowna? What happens to me?
Beautiful. So once you've done your preparation therapy and your intake and you're all safe and suitable for treatment, coming in on treatment day, you'll be greeted by your nurse, who is the psychedelic facilitator. So she will take you into our experience room. So comfortable living room like environment, super nice big comfy recliner that goes all the way back into bed. You will have your initial vitals done. So blood pressure check, make sure you're safe, everything is good to go. The physician will come in and greet you, and they will deliver the intramuscular ketamine injection. So, super easy needle. It's about an inch long. It's really manageable. It'll usually go into your deltoid or your glute, and then you will have about 3 to 5 minutes. So you'll get comfortable in the chair, get prepped, eye shades on and headphones. And basically for the curated music, we use what is called Hemi-Sync. So Hemi-Sync was actually developed by a guy called Robert Monroe in the 1960s. So it was a brain toning technique to synchronize the left and right hemisphere. So it works incredibly well for psychedelic journeys. So after that kind of 3 to 5 minutes of, the music and the ketamine kicking in, you will essentially enter a non-ordinary state of consciousness. So some of our physicians or our medical team calls it a mystical state, but essentially you will completely disassociate from your body. So ketamine is a dissociative anesthetic at its core with highly psychedelic properties. So when that disassociation starts to happen, you will enter a very vivid mindscape where there can be images, pictures, might relive things from childhood, you might see things from the future, and it's essentially that mindscape that's allowing you to process your internal world or your inner emotions.
And are you talking to someone while this is happening, or are you just listening to the Hemi-Sync
So
in the
you
headphones?
are listening to the Hemi-Sync. So yeah, especially Mark, with the doses we're giving ketamine at. So usually it'll start from 0.75 milligrams per kilogram, anywhere up to kind of 2.2 milligrams per kilogram. So at those kind of doses of ketamine, there's no way you're talking to someone. So yeah, very much an internal journey. Lower dose ketamine, they call it psycholytic. So that's maybe where you would have something like a lozenge or a nasal spray of ketamine, and it's actually facilitating the conversation with the therapist. But at those intramuscular doses, those higher psychedelic doses, yeah, it's very much an internal process.
Okay, so the Odyssey method it's the internal, the
So
internal one, right?
yeah, so I think the main thing with the Odyssey method, Mark, is really looking at it holistically. So yes, the ketamine experience can be a huge catalyst. There's a lot of information we can extract out of there. But with our therapy model, it's really looking at how can we use these non-ordinary states of consciousness and actually extract information out of there into our everyday normal waking life. And then the big piece of it as well is actually how are we regulating the nervous system before and after treatment too. So there is a whole host of incredible healing modalities that are out now, from somatic techniques, somatic therapy, breathwork, meditation, yoga. So really with our patient app, what we're looking at doing is creating kind of long-term care before and after treatment. So, and how are we maximizing that psychedelic experience and really helping teach people, other skills, because it's the old thing, Mark, if you give a man a fish, he'll eat for a day. If you teach a man how to fish, he'll eat for life. So really, how are we helping our clients regulate their nervous system outside of our clinic? Because that is the thing, is if someone has a trigger come up in their daily life, their first thing can't be, oh, I just want to go and have another psychedelic experience. It's really, how am I using these other techniques that I've learned, whether it's box breathing, things like that, to really help them stay regulated all day, every day.
So is that what after that experience for a session, and you have that conversation with the therapist, is that the stuff you guys are going through with the therapist, is like this box breathing techniques? And
So most of the work with the therapist, Mark, is really about the person's personal experience. Our app Odyssey Online is where all of that other content happens, and then in the clinic we also do workshops and classes in person too. So we have the in person classes at our yoga space, but then also a lot of the care through the patient app Odyssey Online.
then that's one session, and the Odyssey method, it's multiple sessions of that experience, right?
So great question, Mark. So for Odyssey, what we do is we don't sell it as a package. We sell them as kind of one-off experiences. So in that experience, it will include your preparation therapy, the intramuscular ketamine experience, and the integration therapy with lifetime access to our app. And we don't sell them as a package because we find everyone responds differently and everyone needs different care. So we really like to work with the patient after each experience to see how they're feeling and set up the best maintenance schedule that works for them.
Okay. And if people want to apply to do the Odyssey method uh, at Entheomed, where can they go? I will include a link in the description of this video, or there might be a link below this video. But does that process look like, Fraser, if someone wants to get started?
So if you go to odysseymethod.com, if you fill out the inquiry form there, you will get our discovery guide, and there'll also be a box there to book your free 15-minute discovery call. So both great places to start just to get more information and for us to learn about you and for you to learn about us and see how we can really help you move forward in your mental health journey.
I'm super interested in this personally. I'm excited to see and hear more about this from having this YouTube show with you. And if you are watching this video and you want to have a question for Fraser and get it answered, just drop it in the comments below. We'll read all the comments and bring them up in a new video. So subscribe to this YouTube channel. And then I'm personally interested in those workshops too that you're mentioning, Fraser. So I'm definitely going to head to entheomed.ca to check out any of those in-person workshops.
If you've ever done a sound bath, Mark, they're the money one for sure to go to.
Yes, I have. And I didn't know you guys do sound bath workshops. I'm 100% going to sign up for one of those. I was so surprised when I did my first sound bath. I was like not expecting really anything. I was like, okay, maybe it'll be some cool music. But like I was like kind of an out of body experience almost, this sound bath. It was so incredible.